Well, hello everyone, and welcome to the Tenpenny Files. I'm your host, Dr. Sherri Tenpenny. Here on the Tenpenny Files, we dive into vital and often controversial discussions on topics that will challenge what you've been told and then reveal what's been hidden. These compelling conversations will make you think, spark debate, and hopefully inspire action. Join me here each day at 3 p.m. Eastern Time to hear from authors and documentary filmmakers who have something important to say but are often silenced or censored. Today, our conversation is with our special guest, Dr. Poppy Daniels, with her book, The Dangers of Depo, the world's most dangerous birth control. Dr. Poppy, thank you so much for being here with us today. Welcome to the Tenpenny Files.
Thank you so much, Dr. Tenpenny. It's always a pleasure to speak with you.
Well, let's start with Depo-Medrol as a drug. Why is it called Depo? What is it? And tell us a little bit about the historical backdrop of the development of Depo-Provera, because you go into details about that in your book, and it's really interesting. And I think people need to know where this drug came from.
Yeah, so Depo-Provera is a birth control injection, and the official doctor name of it is depo-medroxyprogesterone acetate. So in the literature, it's referred to as DMPA. And Depo just means it's an injection that lasts for a while, in this case, 3 months. Um, there's also medroxyprogesterone acetate or Provera that is an oral medication that's used a lot in the gynecology world. And that was on the market for a while before Depo showed up as a contraceptive. It was actually back in the 50s and 60s that, do you remember when the pharmaceutical company was called Upjohn Pharmaceuticals? Yeah, so they created Depo and they were able to get it to be used globally as a contraceptive, but they had a really difficult time getting it approved in the United States. And there's many reasons for that we can go into. But the long and the short of it, Upjohn became Pfizer. So Pfizer is the current is the current producer manufacturer of Depo-Provera, the birth control shot. And basically, the long and the
Do they manufacture anything that's beneficial? Everything is awful.
I I'm sure there's something somewhere that has helped someone at some point in time, but no, this Depo-Provera as the birth control shot was used globally, since the 60s. And actually, 1967 was the first year that they sought the FDA approval in the United States. But it was actually not approved until 1990, which was 25 years. So that's kind of unheard of in the pharmaceutical realm. But there was a reason for that, and the reason was they were concerned about increased risk for breast cancer. In animals, so originally the contraceptive research was done in beagles, and there was an increased risk for mammary cancers in beagles. Um, and for a long time, this was a contentious issue with the FDA. They formed advisory committees to look into it, but it was just an uncomfortable situation. But globally, there were many family planning groups that really wanted it to be approved. And we can get into the whole history of that situation because that is a very complex discussion, as I'm sure you know. But ultimately, what happened is they changed the animal studies from beagles to rats and mice. And when that happened, the breast cancer risk became blunted. And so it was not as obvious in a rat model as it was in the dog studies. And so, after 25 years of really lobbying, extensive lobbying by family planning groups, in 1990, they finally approved it in the United States as a contraceptive. I mean, I think that there was a lot of issues around that. The birth control pill was approved in 1960. So 7 years later, they tried to push Depo through. Well, as you probably are aware, they did lots of unethical studies on poor women in Puerto Rico to approve the birth control pill. And unfortunately, all of the family planning groups, organizations, all have eugenics backgrounds. They all started with a eugenics platform. Um, and of course, the leader of Planned Parenthood, Margaret Sanger, in 1921 actually said that the entering wedge of eugenics education is through birth control. She was just flat out, she said it, she published it. So, I mean, that was their motivation, population control. Birth control's goal is population control. And the unfortunate problem with that is that when you're looking at these drugs, the testing that is being done is often unethical, and that includes Depo. So, Depo was studied on poor women in Atlanta in Grady Hospital. So, poor Black women on public assistance is where a lot of the birth control files that were presented to the FDA. And the irony of that is today, Depo is primarily prescribed to women of color, women who are institutionalized, women who are young, basically any kind of potentially marginalized segment of society. They have higher rates of being on Depo for a birth control method.
Isn't that partly where the Gates Foundation comes in and why Melinda Gates calls Depo her favorite birth control?
Yes, and if you look at the history of Depo, it's obviously used worldwide, and one of the big problems worldwide is that scientists began to identify a potentially increased risk for HIV acquisition with women who use Depo-Provera. And so a lot of research started centering on why this was. Initially, it was felt that what happens with Depo, so Depo is definitely binding to the progesterone receptor. But in doing so, what it does is shut down your period. And so you become amenorrheic. You're not having a period. So your progesterone levels fall and then your estrogen levels fall. So as your estrogen levels fall, that causes, of course, bone loss, as we see in menopausal women. It causes women to have irregular bleeding, which is a very common side effect and complaint of women who are put on Depo for birth control. And then ultimately, it can actually cause vaginal atrophy. So, as your estrogen drops in your vaginal tissue, then that tissue becomes more susceptible to infection, and in this case, more susceptible to HIV transmission. And so initially, they thought it was just a low estrogen problem. But then further research has shown that actually Depo binds to the glucocorticoid receptor. So it's basically a steroid. It's a steroid drug. And so it suppresses the immune system directly. It's not just causing indirect problems like vaginal dryness that can increase your risk for HIV. And this was interestingly seen to be a female to male transmission issue. Typically, with HIV, we're thinking males having sex with males being a primary risk factor. But in Africa, it's actually a heterosexual transmission. And in women who are in Depo, what's happening is they started having, so as the research increased, we had several large meta-analyses that was looking at this issue. And what it showed was, depending on the authors and the research center, a 30 to 50% increased risk for HIV in women who use Depo as contraceptive. Now, this was typically in a higher prevalence area, like Africa has a higher prevalence of HIV than we have in the United States. But this research was really starting to cause problems for the global contraceptive family planning. We need to meet all these women's unmet contraceptive need organization. And of course, Gates is a huge proponent of that. But they're starting to not be able to avoid or ignore the literature showing that this increases your risk for HIV. And they do a lot of the research in Africa, India, Indonesia, Asia. And in these places, Depo use is a lot higher than it is in the United States.
You listed some really important and kind of scary side effects. The suppression of the estrogen with bone loss and osteopenia, particularly in younger women, and then also the vaginal atrophy. I mean, no progesterone and low estrogen affects every organ system in a woman. I mean, it just is. That's why there are two sexes, and there's women and there's men, and all the hormonal relationships in women are there for a reason. In your book, you list a long list of side effects and other types of symptoms that are controlled. Name a few of the more common ones that's related to women that frequently when they have Depo as their drug, what they see.
Yeah, so there is a black box warning on Depo right now for bone loss. And so even the FDA has not been able to avoid that issue. And what it specifically says is that because of this risk for bone loss, that women should not be on this contraceptive for more than 2 years, unless there's absolutely no other alternative, which of course we know there's plenty of alternatives to Depo. The irony of that is women are routinely on Depo for years and years and years. And so it's like, did the doctors not get the memo? Did they not read the black box warning? They certainly aren't talking to their patients about it. But this is especially concerning in young women being given Depo because they haven't achieved peak bone mass in adolescence. That doesn't happen till, 25 or so. So if they're on Depo for 4 or 5 years during their adolescence, is there going to be irreparable harm to their bone density? And of course, there's studies that have mixed results. You know how these studies are. They're sort of created to fail. They're created to underestimate risk so that we can push through, whatever drug we want to do. But they haven't been able to avoid the bone loss issue. So the black box warning is currently an issue. Okay. I would say the biggest, just
Explain to patients what a black box, the listeners, what a black box warning is, so they understand the significance of that.
Yeah, so a black box warning is a side effect from a drug that is significant enough that patients must be informed of that risk before they are prescribed the drug because it's sufficient enough to cause a reasonable risk to the patient. So black box warning, we as clinicians are supposed to take that very seriously during our counseling and our informed consent process with our patients. So informed consent, of course, it practically never happens with birth control. It's like, which birth control do you want? Do you want the pill? Do you want the shot? Do you want the ring? Do you want an implant? Do you want a condom? What do you want? How many women are actually given all of these potential risks with every single contraceptive? Hardly any. And so the counseling and the informed consent issue is huge. In the clinical side, having, been an OBGYN for 22 plus years, the number one complaint with Depo is abnormal bleeding and weight gain. So, abnormal bleeding is a huge problem. So, if you get put on this birth control and then you're bleeding every day for 2 months, women don't like that. Newsflash. That is not a pleasant thing for women to have to deal with. And usually, if that is brought up in the counseling session, it's like, well, it could cause abnormal bleeding, but then you won't have your period at all. So, it's kind of like, hey, yeah, that's a temporary problem, but basically we're going to have your periods altogether. So ultimately, you just have to ride this out. But a lot of women stop it because of that. It's a huge problem in your daily life to be bleeding every single day. So that's a very common thing. But then the weight gain. So Depo use is associated with a tremendously more amount of weight gain than any other contraceptive. And if you look back, like I looked back at all my old gynecology books and writing this book to say, how are they explaining this off? Okay. You wouldn't believe the things that they said. They would say things like, well, these women were going to gain weight anyway. The women that use Depo, they're more likely to gain weight in general. And you know what the subtext of this? We have a lot of minority patients on this who are already dealing with obesity. So you're basically blaming the patient for it. But honestly, until we found out about the glucocorticoid receptor issue with Depo, then suddenly the weight gain makes sense. Depo is basically a steroid shot. And so the weight gain comes about just like steroid usage for other medical conditions. And the distribution of weight gain is very similar to people who are on long-term steroids. So it's your middle abdominal weight gain, it's the moon face, it's the buffalo hump, it's the stretch marks. And so it provides what we call a Cushingoid appearance. So Cushing syndrome, of course, is a condition where usually it's from a tumor where you're overproducing cortisol, right, in the body. And it's actually very rare, but we hear about it all the time in medical training, Cushing's disease. But if you see it in real life, it's very rare. But it was very consistently seen in women who gained a lot of weight on Depo is they would develop this Cushingoid appearance of weight gain. And actually, finally, the FDA did put that in its prescribing information, did put potential for a Cushingoid appearance. Well, this is all related to its steroid effect in the body. And of course, if you gain this weight, as many women that I see, I gained weight on Depo. I was never able to lose it. I had problems with my blood sugar and my blood pressure after that. I never recovered metabolically from the Depo. And a significant amount of women had that problem. And so finally, we know why. And I explain it in the book, but always before, people just kind of gloss over. I mean, we're talking 20 to 40 pounds of weight gain. That is certainly significant to any person, especially a young woman who's just on birth control. And so that metabolic effect.
With these side effects, how long do women usually stay on it?
Well, there is a very high rate of discontinuation, and there's a very low percentage of US women. There's only 2% of US women on Depo for contraception. And yeah, and that's just because of the side effects. It's not well tolerated. That's compared to about 11% who are on the pill, about 11% who have permanent female sterilization, about 10% who are on IUDs. So IUDs are a big choice now, both hormone containing and non-hormone containing IUDs. So it's a very low percentage of women that are actually on Depo in the United States. Um, so it begs the question, why are we allowing all this side effects for an unpopular contraceptive anyway? Why would we accept this litany of very significant side effects? And we haven't even gotten to the meningioma issue, which is the current situation that we're dealing with. Why are we allowing this contraceptive to remain on the market when it has this terrible track record? And globally, it's actually causing or increasing the risk for HIV acquisition. Where's the plus side on this equation?
So you mentioned just briefly the meningioma. So explain for the audience what that is and why that is coming up now about in relationship with Depo-Medrol.
Yes. So meningioma is a type of brain tumor. It's actually, I believe, the most common type of brain tumor. It's not considered malignant per se, but it can certainly cause lots of morbidity and mortality. Um, and a paper was just published in the Journal of American Medical Association JAMA Neurology about the association of the increased risk for meningioma in women who took Depo. Now, obviously, women who took Depo are childbearing age women. These are young women. These are not older people. You know, obviously, the risk of meningioma goes up as you get older, as is the case with most cancers. But this is typically considered to be age 15 to 44 is childbearing age. So what this paper showed was a 143% increased risk for meningioma in women who took Depo-Provera. And this study actually involved 10 million patients.
Wow.
The reason they were able to get this amount of patients is basically they did database extraction of healthcare records. And so in hospitals and healthcare organizations that participate in this research group, it's called TriNetX. You can basically go through and using diagnostic codes, you can extract data on whatever healthcare issue you want to study. So this is 10 million people that were looked at in this study. And as I said, it showed 143% risk of increased risk for meningioma in women who use Depo. Now, they also looked at other birth control methods in relation to meningioma and found no association with increased risk for meningioma with any other birth control method, including the birth control pill, including the implants and the IUDs. And so this was very specific to Depo. But in this paper, that 143% increased risk was specifically in women who were older than 31 and who took it for more than 4 years. So it wasn't necessarily, I mean, you had to be on it for a while and you had to be a little bit older, but 31's not that old. I mean, 31-year-old with brain tumor is concerning.
Are these American health care bases, American healthcare databases, or is this a global database that they
This
looked at?
is American, US based.
Wow.
Yes.
And
And
with
actually, the interesting thing about that is the study cites a French study that showed a 455% increased risk of Depo in France when they studied that. And France has a very different makeup of patients. And so that was even more of a profoundly abnormal relative risk. But one of the comments that they make, of course, is that your absolute risk is very low. And basically, you're going from like 50 cases per 100,000 women to 131 cases. And that's just a small amount of, of cases. But if you multiply that times the millions of women that take Depo, especially globally, if you put global data into that, not just US, that's millions and millions of women having to get treatment for brain cancer compared to someone who didn't take Depo. That's very significant.
Is that expression that um, they say, figures lie and liars figure. So what that
Yeah,
means is that they can crunch numbers any way that they want to make the numbers be the way that they want them, or to minimize the risk, or to say, oh, it's so small, your absolute list really doesn't count, and that is just nonsense. And it makes me wonder,
absolutely.
what is it going to take to get the attention of the FDA? I mean, this has been going on for, it took them 25 years to approve it. And it's been going on for a very long period of time. And the list of side effects that you list in your book are just, pages long of what people have to put up with. And the only things that we've really talked about today are the most prevalent side effects, or the most common ones that people deal with. And then women say, I don't want to deal with this daily bleeding stuff anymore. But the list is very, very long. What is it going to take to get the attention to the FDA about this?
Well, I think this is an important point, and I think we finally might have the administrative support of the FDA where we have not previously. When it comes to the HIV risk, so there has been a citizens petition before the FDA that was submitted in 2019 to have the FDA consider removing Depo from the US market regarding the risk for HIV acquisition. And this was submitted by some very high level scientists. There were 20 signatories, and most of them were either epidemiologists, public health experts, physicians, some people in the reproductive health world who basically were saying, you are putting women at risk for dying from HIV because of a birth control method. And you're not informing her of this because it's considered a category 1 contraceptive. That means no restrictions on use in the United States. And so that citizens petition was filed in 2019, and it has not been responded to, other than, they have 180 days to respond to a citizens petition at the FDA. They have to say, hey, we got your petition, we're looking into it. And they basically said, this is a complex issue. This is a complex issue that spans many different areas of society. So take that what you will. And so it's going to take some time to look into it. Well, this is 2025. So it has been 6.5 years that they have. And when you look in, yeah, I mean, you can say, how much is bureaucratic backlog? Because that's what they always blame it on. We don't have enough staff. This is too, like, we don't have enough people to look into this. They get inundated with citizens petitions. They have to wade through all of that. But how much of it do you finally say, this is stonewalling and foot dragging because you don't want to cast any aspersions on this particular method of birth control? Because this could literally have global implications to the global family planning organizations.
Well, hold that thought right there, Dr. Poppy. We're going to take a short break to hear from our sponsors because this is really, really important. And I have a couple of follow-up questions to dig into that about. So we're going to take a quick break right here. America Out Loud Talk Radio plays the Tenpenny Files on iHeartRadio Network daily at 3 p.m. Eastern. The next day, the Tenpenny Files can be heard on Spotify, Pandora, Apple, TuneIn, iHeart Virtual Studio, and my platforms at dr10penny.com. And we also post them on our Substacks at dr10penny.substack.com. You can listen to any of these shows on America Out Loud News on their media player from anywhere in the world. So because there's so many books and documentaries and so little time to read and watch, this show is meant to maximize your time and jumpstart your interests. We have a great message from our sponsors. Sit tight. We'll be right back for more. Zeolite is a detox spray. We work specifically with a company called Touchstone Essentials. They are an incredible company. We've been working with them now for several years. And zeolite is a mineral that goes through your body like a one-way basket. It will clean out heavy metals such as arsenic and mercury, aluminum, cadmium, and it hooks onto those metals from a one-way perspective. So once it's bound, it goes out through your urine or your stools and doesn't get redeposited in other places. Everybody needs to have a detox product in their life, and this one is so easy to use and it's so safe. You can take it when you're pregnant, you can take it when you're nursing, you can give it to little children, you can even give it to infants, and quite frankly, I give it to my dog. I actually put a little bit of the zeolite in his water because until we all stop living in a toxic world, we all need to get some of those extra toxicities out, the heavy metals, the persistent organic pollutants, the things that are floating through the air, the different things that we come in touch with in our environment. And we are a big fan of zeolite from Touchstone Essentials. We've been a big fan of their products for several years. Go to dr10penny.com/detox to get your first bottle of zeolite spray for $50 off. Well, welcome back, everyone. We are talking today with Dr. Poppy Daniels about her book, The Dangers of Depo, the world's most dangerous birth control. Let me tell you a little bit more about Dr. Poppy Daniels. She's a gynecologist who obtained her undergraduate degree and MD degree at the University of Missouri and Columbia. She completed a residency in obstetrics and gynecology at Drexel University Hahnemann University Hospital in Philadelphia, has been in private practice as an OB-GYN since 2003. In addition to traditional OB-GYN services, she has completed extensive specialized training in bioidentical hormone therapy, integrative thyroid treatments, and holistic health. So she is certainly an expert to be talking about all of these things and bringing us this great information today. Poppy, I just want to read through in your book on the dangers of Depo. We were talking a little bit about the side effects. There are 4 pages of side effects that you have listed here in the book. And some of them are like swelling, excessive thirst, abdominal pain, all kinds of different infections, depression, insomnia, decreased libido, urinary tract problems, body odor. And then you mentioned so much about the weight gain. Is this just another opportunity to prescribe Ozempic? Now that we're going to get women, and to gain all this weight. Oh, well, we got a solution for that. We'll just keep you on this weight gaining, terrible, awful drug, and we'll give you another terrible, awful drug to get you to lose weight. Have you seen that in terms of combination going on there?
Well, actually, something you mentioned that I think is extremely significant is mood disorders. So, mood disorders, so all contraceptives, all hormonal contraceptives increase the risk for mood disorders like depression, anxiety. But Depo has a significantly higher association with anxiety, depression, and suicide, increased suicide risk. And that's particularly seen again in the adolescent age group, which is disproportionately, basically the idea is, oh, you're an adolescent. You can't remember to take a pill every day. So we're just going to give you a shot. You're going to come in 4 times a year. It's going to be perfect. You don't have to remember to take that pill. You're going to be covered for birth control. Well, then all of a sudden, this woman starts having depression, anxiety. So what happens? She gets prescribed an anxiety or a depression medication. And you have to say, okay, which came first, the chicken or the egg? Well, unfortunately, these hormonal contraceptives are known to cause or exacerbate mood disorders. And so then you end up on another medication because you're having a side effect from the original medication. And if you have a clinician who is not well versed in this literature, and I can tell you, even OBGYNs are not, they're just not. They're said, okay, here's your options. They're not like, did you know there's a double risk? It's actually 2 to 3 times higher suicide risk of in women, in adolescent women who use Depo as a contraceptive. Is that significant? Absolutely, it should be. These poor women, and they could get hospitalized with their, depressive episodes, the suicide attempts. I mean, we have a major problem with mood disorders in this country already. And here you are sort of exacerbating it by, or causing it. There are women that didn't have that problem before they went on the birth control method. And so the other thing is, the whole reason I co-wrote this book is that my co-author, Tracy Johnson, she actually approached me.
Yeah, I want to get into that a little bit more about the first two chapters of your book is your co-author Tracy Johnstone and her horrible experience with Depo. Why don't you go into that a little bit? You said that I know she approached you way after the fact. She wrote about it in the book.
Yeah.
As even after she stopped taking Depo for years, she had horrible side effects, ended up with a hysterectomy, ended up with all these different things before she got to you as a holistic gynecologist and put her back on natural hormone replacement. And talk a little bit about when she came to you, her horrific journey that she was having or had with the Depo.
Yeah, it was really awful. I mean, not to mention, the quality of women's health care in this country is just not great. The solution is birth control or hysterectomy. Let's try a different form of birth control for you. We won't try to figure out your underlying issue. We'll just kind of, medicate you or rip out your reproductive parts. That's women's health. But yeah, she had a terrible time, and honestly, piecing together her story, she had what a lot of women have, which is sometimes they get worse after they're even off Depo. And the reason for that, this is a big issue, is that they have adrenal suppression. You know how you're not supposed to stop steroids abruptly because your adrenals will crash and you will, have serious medical issues, even end up in the ICU sometimes. Um, so typically, if somebody's on steroids long term, they have to be weaned off them or tapered off of them so they don't have an adrenal crash. Well, nobody told that to women who stopped Depo because most doctors don't even know it's a steroid. So they're not even thinking that that is an issue. So some women, they actually don't have problems until they stop the Depo. Then they stop the Depo, their adrenals go south, and their immune system has been negatively affected by the Depo. So in Tracy's case, she just kept having infection after infection after infection. And finally, they said, we've got to go in and take everything out. And then even after the surgery, she had all kinds of problems with her hormones and her adrenals. She didn't know it was her adrenals at the time. And so when I had been posting some things about Depo, especially in regards to this newest issue, which is the HIV association. There's hardly anyone talking about it except in the academic world, and those people aren't on social media very much. So it's like I was on social media more. So she saw some of my posts about Depo and the negative effects on the immune system. So she contacted me and said, "Hey, could this be my problem? Like, I'm trying to piece together what happened to me. Like, I was totally fine before I took Depo. And then now I'm like, I have no female body parts anymore. My brain doesn't work, my hormones don't work, my adrenals don't work. I'm getting all these UTIs and all these infections. Can you help me figure out what is going on?" And so I kind of filled in some of the pieces of the puzzle for her in terms of trying to like explain exactly the process that caused this. Because, you go to the doctor and you say, "This Depo caused me to have this," and they'll be rolling their eyes and saying, "Oh, here's one of those patients.
Yep.
Depo caused your hysterectomy." Right. You get gaslit all the time because the doctors don't even really understand the drug itself that they're prescribing anyway. And on top of that, she's in Canada, which is a nationalized health system. So you can imagine that she just didn't get anywhere. And I finally said, "You're going to have to go outside the mainstream system. You're going to have to find someone who knows how to test hormones and do bioidentical hormone therapy, someone who knows how to test your adrenal function, your immune system. A functional medicine approach, basically, is the only way that you'll be able to recover from Depo." And since that time, I've actually become friends with another woman in the US, because Tracy's in Canada, who was severely debilitated by Depo. And she's actually involved with the MAHA movement now in Pennsylvania. And her life was totally destroyed by Depo. But again, most people think she's crazy when she goes to the doctor and says, "Well, after Depo, I had this, and this." The doctors are like, "Oh, you're a hypochondriac." They
So
don't take it seriously.
let's change tracks just a little bit because you've been an OB-GYN for a long time, more than 20 years. And so you were trained, conventional training, did all of your conventional training, just like I was, an emergency medicine physician and did all the training and all of that. And then eventually both of us kind of woke up and said, we're not doing this anymore and went into a different direction. What was your wake up call and how did you decide to go more into integrative and functional oncology, or not oncology, but OB-GYN, rather than just stay the main course?
I would say number one was the Women's Health Initiative study, which I know you had kind of wanted to talk about a little bit if we had time. Because that was the Women's Health Initiative was the largest hormone study that had been done to date, and it was the first randomized controlled trial of HRT, and the results were not good. And that happened as I was finishing training. And so I was kind of like, wow, I don't want to cause all these other problems by giving a woman this hormone pill. But at the same time, my patients are like, "I need some hormones, but I don't want that. So what do you have for me?" And I'm like, "Well, I guess I'm going to have to find out because this is all they teach us." And so it just started me on a path of really trying to understand hormone therapy, trying to understand hormone testing, which is usually never done before women are given hormones. They're just based on symptoms. So I sort of went down this whole rabbit trail of research into kind of like you did with vaccines, I kind of did with hormones.
Yeah,
I said, there's got to be more
you're-
to this story.
in my practice,
And
I did a lot of, bioidentical hormones. And I just remember when that study came out and we were doing a lot of saliva tests and urine, saliva testing. And now we do more urine testing, more Dutch testing and with the Dutch tests and stuff like that. But I remember all these women that would come in and say, I turned 50 and my doctor thinks I need to be on hormone replacement. Well, did he test you? Does he even know, even from a convention? She said no. And I'll never forget the woman that came in. She'd stopped her periods. She was 50. Her OB-GYN said, you need to get on hormone replacement. You need to start taking birth control pill and or estrogen patches or whatever it was. And we did a saliva test on her, and her estrogen levels were through the moon. And I said, if you would have gone on this pill, it would led you to cancer because
mhm,
so many of the cancer related, so many cancers related to estrogen are because you overdid it. You got more than what you
Hmm.
needed. And so I remember that distinctly and going through those things. What do you think about the new thing about the FDA removing the warning about using estrogen for menopausal symptoms? What do you think that is that going to? I don't even know what made them decide to do this now. And if they were going to change anything in women's health, it would have been this whole issue that you've been talking about. Why did they do this one? And explain to our audience what they actually did.
Yeah, so it's a little complicated because it's still unfolding. It's not all the way, it's not like, okay, we're done with this and we're moving on to another topic. But the biggest issue was regarding the labeling on vaginal estrogen. So the FDA does this even with bioidentical hormones. It'll slap the same warning list that are on birth control pills on bioidentical progesterone, for instance. So, bioidentical progesterone or permetrium is a very safe hormone. We use it all the time. But I still have to tell my patients the label says this will cause you to have a stroke and a blood clot, and it doesn't do that. This is just the FDA and their infinite wisdom, saying we're just going to CYA and just plaster these, side effects on everything. So I do think it's a legitimate concern that, especially on vaginal estrogen products, which are basically used locally for vaginal atrophy, that a lot of women were not prescribed these medications because it carried a warning that was a throwback from WHI that said heart attack, blood clot, stroke, breast cancer. You can get all these things from this product. Don't use if you have, any risk factor for those things. And so we see a lot of women, especially older women, who have recurrent UTIs from vaginal atrophy. They're in nursing homes, they get admitted to the hospital, they get septic, they die, and ultimately they could have benefited from some vaginal estrogen to treat that condition. Lots of women, even myself. I mean, I'm 53 now, and for the first time ever, I had like 3 UTIs in a year. And I'm like, duh, you're a hormone doctor. You need to fix this. So it is a legitimate concern that women were maybe not getting individualized treatment because they were being scared away from certain therapies because of the WHI. The WHI and its subsets, that can be a whole nother discussion, which I'm happy to discuss if you want to. But the long and the short of it is that natural estradiol vaginally is not risky for a lot of women, but was being withheld because of the labeling from the FDA. And so that was one of the big contentions was you're using this 20 plus year old study to not give women who have a legitimate reason to use vaginal estrogen. It's being withheld, and doctors are afraid to prescribe it because of that. So it's like, you know how it is. The pendulum swings to one extreme or the other. Everyone should be on hormones, especially this HRT Primpro, which, by the way, contains medroxyprogesterone acetate as the pro part, Provera. So that breast cancer risk was actually not from estrogen in that study. It was from the synthetic progestin, medroxyprogesterone acetate. And so, if you do not know how to read the study and break all this stuff down, then
You
you're going to say,
don't take the time to do it.
yeah, you're going to say hormones cause breast cancer. People shouldn't take it. So the pendulum swung from everybody should take HRT, synthetic HRT, of course, to prevent having a heart attack, to nobody should be on hormones because it's too risky.
Yeah.
So I think some of these changes are legitimate, but they have to be sort of discussed with patients in a intelligent way so they can know what their personal individual risk is from hormones and whether or not, like you said, if I don't need estrogen, I don't want to be taking estrogen. That's not a good situation.
And I want to explain two things for our listeners here. One is that, and I use this a lot in my practice when I'm seeing patients, what Dr. Poppy was talking about with as you get older, you get some vaginal, your vaginal tissues dry out, and they call that vaginal atrophy. And when that happens, where your urethra comes through, it dries out and opens up that urethra a little bit. That allows more bacteria to come up into your bladder and leads to more bladder infections. So that's the what she was talking about. And putting that little bit of vaginal estrogen there puffs up those tissues and allows that urethra to go closed, so you're not getting chronic bladder infections. So that's the one thing. The other thing I used to say all the time is like Provera, or the medroxyprogesterone, the synthetic progestins, can cause heart attacks and blood clots and strokes. But natural progesterone is absolutely essential for normal births. So your baby can't be born without natural progesterone, but synthetic progesterone can cause all these side effects. So how can they be identical? They're not. So when your doctor wants you to go on some natural progesterone, particularly when you do the natural progesterone, when you do with estrogen, because you want those two things to work together, there's no reason to go, oh my gosh, it's going to cause me to have a blood clot or a stroke, because it's a natural product that your body actually needs. So it's really, really, and it's a really big topic. We could come back sometime and just talk about bioidentical hormones and how it's different from the synthetic hormones that are prescribed by your normal gynecologist. But I think that's really important. What are your, in our closing couple of minutes here, because I think this is such a great topic, and it's a broad topic for women that both of us know a lot about it. You know, obviously a whole lot more about it than I do as an OB-GYN, but I've done a lot of hormones in our practice over the years, and it applies to all women of all ages. And so, what is from this book that we were talking about today, this one, The Dangers of Depo, which I really encourage everyone to get. If you're on Depo, you need to get on it to know how to get off. And if you're considering it, you need to know the full risks. So, two quick things, as we've got just a few minutes left here. Number one, what would you advise women to do who have been on Depo and they want to get off? And the second thing is, what is your main take home from your book today?
Well, so women who are trying to recover from Depo, you need to get your hormones thoroughly evaluated. I actually prefer saliva over urine, but any kind of in-depth hormone evaluation by a knowledgeable practitioner is really important. And unfortunately, your average OBGYN may not be the person for that. You often have to seek more of a functional integrative practitioner who is familiar with hormone testing, but that needs to include adrenal testing because your adrenal function is so important in your recovery from Depo to know where your adrenals are at and what you might need to do about it. I think that the take home message, the reason we wrote the book, number one, was to warn other women just about the informed consent process. Like, you need to understand that this particular form of birth control, we are not kidding when we said it's the world's most dangerous contraceptive. And now with this meningioma data, we have brain tumors to add to that body of side effects that has been going on for decades. And I just think it's high time that women understand there are so many better options out there. And frankly, I believe Depo needs to be removed from the US market and the global market, to be honest.
And what sorts of things can people do to get in contact with you? Where are you located? And are you taking new patients? And how can people get hold of you?
Yes, I am in Missouri. I'm in Southwest Missouri, Ozark, Missouri, outside of Springfield, Missouri. And my website is drpoppyandco.com because I have some nurse practitioners that work with me, lovely women. I'm on social media, Dr. Poppy on Facebook, and I'm at Dr. Poppy BHRT on X, formerly Twitter, and also on Instagram, Dr. Poppy BHRT on Instagram and X. I do post a lot about controversial topics, as you know, and feel free to follow me on those platforms.
And are you taking new patients?
I am.
That's great. And so where would be the best place that they could get a hold of you on your website? Say your website again a little bit slower, so people
So it's
can find you.
DRPOPPY, Dr. DR Poppy and Co, ANDCO.com. And there are frequently asked questions on the website, and you can submit a request for an appointment on the website if you would like. Get more information about the practice there.
Wow, that's just great. So, this is just such a great conversation, Poppy. I'm so glad, and I really hope that you will get people involved in getting this drug off the market. I mean, there's a lot of activity inside of Maha right now about, making America healthy again. And this is one way we could make Americans, women healthier, is to get rid of this awful drug that's been given to them. I think that's really, really important. So I want to thank you so much for your work. Thank you. This is the book again. It's not real thick, and so you can get it and read it real quickly. The Dangers of Depo, The World's Most Dangerous Birth Control by Tracy John Stone and Poppy Daniels, MD. I think it's really, really a marvelous book. I think that, and this whole topic of bioidentical hormones and what the benefits are versus the risks, and why your normal gynecologist doesn't know much about it, and why you need to get hold of a functional practitioner, particularly a functional OBGYN, to go through all of these things. It's really, really important. We'll probably have her back at some point and talk about her new book that's going to be coming out about infertility. She didn't even mention that, but she's working on another book that is really, really important, particularly with all the COVID nonsense of all the infertility that have come up. So it's a really important topic for everyone. So I thank you again, Dr. Poppy Daniels, for joining us here today. And with that, I want to close out with one of my favorite verses from the Bible. I close all of my podcasts with, whether they are live or pre-recorded, which is Romans 12:12. Rejoice in hope, be patient in trouble, and be persistent in prayer. And remember to lean into God, trust Him for everything. He will never let you down. So tomorrow's broadcast
Amen.
PM is right here on AmericaOutloud.news and iHeartRadio. Our shows are then uploaded to the podcast platforms of Apple, Spotify, Pandora, TuneIn, and iHeart Virtual Studio. You can also follow me on my website, which is dr10penny.com, drtenpenny.com, where we also upload all of these interviews as podcasts at that area. We also put them on our Substack pages, which is dr10penny.substack.com and tenpennywalkwithgod.substack.com on Sundays. They're all totally free. Please like and follow them. That gives us a good boost over there on Substack. I don't believe in paywalls on my Substack. I feel if I'm going to spend all that time to write it, I want you to read it. So go over and just like it and follow us over there. So it's been great having another conversation with you today. Have a great rest of your day. We'll see you the next time on the Tenpenny Files right here on iHeartRadio. Have a good day, everybody. Goodbye and God bless.